Here's a detailed, structured, and clinically complete monograph for Atazanavir, suitable for medical, pharmacy, or nursing reference use. I've expanded on each section with clear textbook-level detail. Atazanavir Complete Drug Monograph. 1. Generic name, drug class, brand name, and drug forms category details. Generic name Atazanavir. Drug class, antiretroviral agent, protease inhibitor, PI. Brand name Rayataz. Drug forms, capsules, 100 milligrams, 150 milligrams, 200 milligrams, 3 milligrams. Oral powder for suspension, 50 milligrams per packet. Definition: Atazanavir is an antiretroviral medication that belongs to the HIV-1 protease inhibitor class. It is used for the treatment of HIV-1 infection in adults and pediatric patients. Atazanavir inhibits viral replication and reduces viral load, improving immune function, CD4 count, and delaying progression to acquired immunodeficiency syndrome, AIDS. It is not a cure for HIV, but helps maintain long-term viral suppression when used in combination with other antiretroviral drugs. Number 3. Mechanism of action. Atazanavir binds reversibly to the active site of the HIV-1 protease enzyme. HIV protease is responsible for cleaving the GAG-pol polyprotein precursor into functional viral proteins, e.g., reverse transcriptase, integrase, structural proteins. Inhibition of this enzyme prevents the formation of mature infectious virions, resulting in non-infectious immature viral particles, reduced viral load in plasma, improved immune function, higher CD4 count. Unlike some other protease inhibitors, Atazanavir has less effect on lipid metabolism, making it more favorable in terms of metabolic side effects. Pharmacokinetics, parameter, description, absorption, well absorbed when taken with food. Bioavailability 60 to 68%. Reduced significantly if taken without food or with acid-reducing agents. Distribution, volume of distribution, 2.3 lb kilograms, 86% bound to plasma proteins, mainly 1-acid glycoprotein. Metabolism, extensively metabolized by CYP3A4 in the liver. Minor pathways involve UDP glucuronosyltransferase, UGT1A1. Elimination, predominantly via feces, 79%, urine, 13%. Half-life, T-half, 7 hours, unboosted, 12 hours when co-administered with ritonavir, a CYP3A4 inhibitor. Steady state, achieved within 5 to 7 days of daily dosing. Therapeutic uses, primary use, treatment of HIV-1 infection in combination with other antiretroviral agents. Off-label, sometimes used for post-exposure prophylaxis, PEP, in selected cases when preferred options are unavailable under expert supervision. Number 6. Indications. Indicated in adult and pediatric patients, 3 months of age, 10 kilograms body weight, with HIV-1 infection. Must always be used as part of a combination antiretroviral therapy ART regimen to prevent resistance. 7. Contraindications. Category examples reason. Hypersensitivity. Known hypersensitivity to Atazanavir or formulation components. Severe hepatic impairment. Risk of accumulation and toxicity. Co-administration with contraindicated drugs due to potential for life-threatening interactions, CY3A4 metabolism interference. Specific drug interactions. Rifampin induces CYP3A4, Atazanavir levels. Alphazocin, simvastatin, lovastatin, risk of severe toxicity. St. John's wort induces metabolism. Ergot derivatives, triazolam, midazolam, pimozide, serious adverse effects possible. Number 8. Precautions. Before taking this medicine. Before starting Atazanavir, assess medical conditions. Liver disease, hepatitis B or C, increased risk of hepatotoxicity. Cardiac conditions may cause PR and QT interval prolongation. Kidney or gallbladder disease, risk of nephrolithiasis and cholelithiasis. Diabetes mellitus may worsen glycemic control. Hemophilia may increase bleeding episodes. Drug interactions. Avoid concurrent use with acid-reducing agents, PPIs, H2 blockers, and antacids. They reduce drug absorption. Adjust timing if co-administered, e.g. take antacid 2 hours before or after. Pregnancy and lactation. Pregnancy, Category B, no evidence of fetal harm, however, should be used only if clearly needed. Breastfeeding, not recommended in HIV-positive women to prevent viral transmission. Others, maintain adequate hydration, monitor for signs of jaundice, bilirubin elevation, ensure ART adherence to prevent resistance. Number 9, how to use. Take once daily with food to improve absorption. Capsules, swallow whole, do not crush or open. Oral powder, mix entire contents with food or beverage, milk, applesauce, etc. Consume within 1 hour. Usually combined with ritonavir, 100 milligrams once daily to boost effectiveness, increase plasma concentration. Number 10, dosing information. Adults, regimen, dosage, boosted regimen, preferred. Atazanavir 300 milligrams plus ritonavir 100 milligrams once daily with food. Unboosted regimen, less common. Atazanavir 400 milligrams once daily with food for treatment-naive patients only. Pediatric, 3 months, 10 kilograms, dosing based on body weight. Typically, 150 to 300 milligrams once daily with ritonavir. Refer to pediatric tables for specific weight-based dosing. Hepatic impairment, mild. Caution, monitor liver function, moderate to severe, avoid use. Renal impairment, no dosage adjustment needed except for patients on hemodialysis. Avoid unboosted atazanavir. Missed dose and overdose. Missed dose, take as soon as remembered, unless it's near the next scheduled dose. Do not double the next dose. Resume regular schedule as soon as possible. Overdose symptoms, severe nausea, vomiting, jaundice, bilirubin accumulation, cardiac conduction abnormalities, PRQT prolongation, dizziness, or fainting. Management, no specific antidote, supportive and symptomatic care, monitor ECG and vital signs. Gastric lavage or activated charcoal may be considered if within 1 to 2 hours of ingestion. Now, number 12, stop or avoid taking. Stop atazanavir and seek immediate medical attention if severe skin rash, blistering, or peeling, Stevens-Johnson syndrome, jaundice with dark urine, pale stools, or upper right abdominal pain, allergic reaction, swelling, difficulty breathing, chest tightness, irregular heartbeats, or chest pain. Avoid sudden discontinuation without medical supervision, may lead to viral rebound and resistance. Number 13, side effects, common, I5%, nausea, vomiting, diarrhea, headache, fatigue, rash or itching, abdominal discomfort, indirect hyperbilirubinemia, benign jaundice, peripheral neuropathy. Less common, serious, hepatotoxicity, elevated AST, ALT, PR interval prolongation, arrhythmias, palpitations. Severe rash, Stevens-Johnson syndrome, nephrolithiasis or cholelithiasis, hyperglycemia or insulin resistance, fat redistribution, lipodystrophy, increased bleeding in hemophilia patients. Now 14, vital information monitoring parameters, parameter monitoring frequency, liver function tests, ALT, AST, bilirubin, baseline, then periodically, ECG, baseline and if cardiac risk present, renal function, periodic, CD4 count and HIV RNA viral load, every 3 to 6 months, blood glucose and lipids, periodically, adherence check, every visit. Key reminders, always take with food, avoid missing doses. Regular lab monitoring is essential for safety and efficacy. Number 15, drug interactions. Atazanavir is a substrate and inhibitor of CYP3A4 and also inhibits UGT1A1. Hence, it has numerous potential interactions. Drugs that decrease atazanavir levels, CYP3A4 inducers, rifampin, rifabutin, carbamazepine, phenytoin, phenobarbital. St. John's wort, efavirenz may require dose adjustment. CHAG drugs that increase atazanavir levels, CP3A4 inhibitors, ketoconazole, itraconazole, clarithromycin, ritonavir, used intentionally for boosting. Drugs that are increased by atazanavir, toxicity risk, midazolam, triazolam, pymazide, CNS toxicity, ergot derivatives, vasospasm, statins, simvastatin, lovastatin, rhabdomyolysis risk, oral contraceptives, altered hormone levels, warfarin, monitor INR. Other interactions, antacids, PPIs, decrease absorption, separate by GORI 2 hours or avoid. Tenofovir may lower atazanavir levels, monitor viral load. Methadone, levels may decrease, monitor for withdrawal. Summary table, feature atazanavir, drug class, protease inhibitor, PI, main indication HIV-1 infection in combination therapy, route, oral, dosing, adult, 300 milligrams plus ritonavir, 100 milligrams once daily with food. Key metabolism, CYP3A4, UGT1A1, elimination, urine. Major warnings, hyperbilirubinemia, cardiac conduction effects. Common side effects, nausea, jaundice, rash. Major interactions, rifampin, PPIs, simvastatin, St. John's wort. Pregnancy class B. Thank you. Have a nice day.